One of the things that patients often ask me is what is special about this office. Over the years, our office has become more and more subspecialized. The development of technology has been such that we now focus on a much more elaborate type of reconstructive surgery. We still do basic hip and knee replacement. However, we bridge the gap between a very good outcome and an excellent outcome. And over the years, I've developed special interest in computer-assisted technology, the ability to align the leg and not focusing only on the knee or focusing only on the hip, but rather looking at the whole gamut from the very moment your foot touches the floor with reverberation all the way up to the spine. The very rough way of comparing it is if you have a joint replacement, which is the equivalent of changing a tire. The computer alignment allows you to align the wheel and to balance the wheel so that the tire will not wobble and will be more performing. In order to achieve that perfect balance that will make the difference between a satisfied patient and a patient that has reached the highest level, the so-called forgotten joint score. Not only the patient will do well and will not need a revision as an endpoint, but we actually forgot about their joint. And that's an amazing compliment when the patient comes in and say, "No, doc, I don't remember which side you did." And that happens. Well, the reason why you do something is because you truly believe in it. So it's something that you feel that you are the calling to. And I didn't start as a physician. I started my career as a physicist. I had a great amount of respect and a tremendous amount of pleasure in mathematics and trying to figure out how is this world built and how can we make a better world through the technology. Inevitably, that led to my applying physics to medicine. And one of the best suited fields to do that is orthopedics. The next thing in hip surgery is really how do I put the hip in? 12 years ago I stopped doing regular approaches and I do what's called now muscle sparing approach. A lot of people will call it MIS surgery or minimally invasive surgery. More modern technology focuses on trying to shrink the incision to as small as possible extent so that the patients are happier, both cosmetically but also functionally. It is true that a short incision will give you a faster recovery. However, through robotics and through a higher level of accuracy of positioning, I have the best of both worlds. I'm able to guarantee a small approach, a rapid recovery within 3 weeks. Normally, most patients within 3 weeks will walk without a cane. But also, I know that I have done the best possible positioning and placement of the implants, and therefore the long-term outcome is safeguarded. The important thing to realize about the knee surgery is that the knee has to be in perfect balance in order to function well. A group of us started developing what is called a intelligent or smart liner, and they go inside the joint, and then you have a replica of the sensor which is now seen onto the screen. As the surgeon performs certain maneuvers, he or she will then be able to see the contact point move around, the intensity of the direction, the trajectory, as well as the magnitude of the pressure. Now we have the ability of gauging not only how your joint moves in space, but with how much resistance and how much pressure does it move in space. And nobody's done that before. So this is really truly a revolutionary technology that allows us to optimize the function of the knee. I think a smile on the patient's face when they come in is always so, it's hard to describe. It's a joy which is a combination of pride and satisfaction when you see someone coming in who you know was limping and was grimacing in pain, and suddenly they come back and they say, "Thanks, doc." That's the best feeling you can have.